Good afternoon. It's Friday, November the 2nd, and welcome to the reading of the Record Courier. Let's begin today's reading with the area deaths. James E. Long, known as Jim, of Ravenna, passed away on October 22nd at the age of 92. Funeral arrangements are being handled by Shorts Spicer Chryslip Funeral Home, and details for a celebration of life will be forthcoming. Joy L. Ramsell, age 61, lifelong area resident of Windham, passed away peacefully Thursday, October 29th, at Trumbull Memorial Hospital with her family by her side. Per her request, services are private. Gary J. Krause Jr., 51, of Manawa, Ohio, passed away unexpectedly on Tuesday, October 27, 2020, due to complications from COVID-19. Private services will take place for the family. A celebration of life will be held at a later time. Wilbur J. Lott, 79 years of age, died Thursday, October the 29th. Arrangements are by the Green Family Funeral Home and crematory services in Manawa. Thomas Schilling, 71, went to be with the Lord on October 27th. He passed peacefully at St. Joseph Mercy Hospital in Warren. Due to COVID-19, there will be a private service held. Monty Wirt, 88, passed away peacefully in her sleep on Saturday, March 7th. Monty requested no calling hours, and the family has had a private burial. Ralph A. Daly, 75, of Ravenna, passed away on October 23rd. Ralph's wishes for cremation have been honored and no services will be held. Harry Dean Haney, known as Red, 86 years old, passed away peacefully on Saturday, October 24th. Robert L. Lauderer, or known as Bob, beloved husband of 50 years to Debbie, passed away Saturday, October 31st at the Avenue of Aurora. Calling hours will be Tuesday, November 3rd from 5 to 7 p.m. at the Shorts Spicer Chryslip Funeral Home in Streetsboro Chapel. Graveside services with burial to follow will be 11 a.m. Wednesday, November 4th at Evergreen Cemetery, Streetsboro, Ohio. That concludes the reading of our area deaths for today. Now, on to our first article. University Health Portage Medical Center leaders watch hospital capacity amid COVID-19 spike, by Bob Gagins. Despite a rising number of COVID-19 related hospitalizations around the state, capacity locally at UH Portage Medical Center in Ravenna has not been taxed, according to UH Portage Medical Center President Bill Bonneau. We have beds for about 135 patients, he said. We typically run somewhere between 80 and 100 being used, depending on the time of year and what's going on. Right now, luckily, and over the past couple weeks, we haven't had any space issues at all. Ohio set yet another record on Thursday for the total number of people hospitalized at one time with the virus. On Thursday, 1,536 Ohioans were hospitalized, including 416 in intensive care units and 226 on ventilators, according to the state. Bonneau said on Thursday that the Ravenna Hospital currently has fewer than 10 COVID-19 cases, although the exact number varies from day to day. Portage County Homeland Security and Emergency Management Director Ryan Shackelford said planning is ongoing with partners around the county, including the health departments, UH, the Northeast Ohio Medical University, Kent State University, Family and Community Services, and others. Right now, our partnerships in Portage County are strong and have been since the get-go, he said. In April, Portage emergency planners had eyed Ravenna High Schools and as an alternative place to treat people in the event that UH Portage was overwhelmed with COVID-19 patients. The school is only about a mile away from the hospital on North Chestnut Street, and at the time, the school had gone to remote learning. But now that in-person classes are in session, using the high school as an overflow site is likely not an option, according to Superintendent Dennis Honkala. It does not seem like this would be a very viable option at this point, he said. We intend on keeping our students in the high school and the school open for learning and extracurriculars until forced to do otherwise. Benoit said using Kent State University would likely present a similar dilemma. Shackelford said Family and Community Services has established partnerships with area hotels to provide quarantine space for individuals who do not want to endanger their family members. Bonneau said the hospital has lots of other options before a local overflow facility becomes necessary. We can probably go up to 130 patients and still do pretty well, he said. Like we did earlier in the pandemic, we can also use other dedicated spaces in the hospital. Those include pre-op, post-op areas, pre- and post-op areas for the cardiac cath labs, and other spaces, he explained. Most importantly, he said, Portage Medical Center has support within the University Hospital Network and partnerships with other area hospitals through the Akron Regional Hospital Association. If any one hospital would begin to get overwhelmed, we can reach out to hospitals in UH and in our zone, said Bonneau. We may end up transferring some patients to even out of the load. We did this at the height of the pandemic back in March and April. The state is divided into zones, and many in Portage County area, which includes Akron, Canton, Youngstown, and areas in between, took inmates from Elkton Prison in Columbiana County when it experienced an outbreak earlier this year. Locally, Bonneau said he and Shackelford speak regularly along with Portage County Health Commissioner Joseph DiOrio, Kent City Health Commissioner Joan Seidel, and representatives from Kent State University and Neomed. Shackelford said the current spike in cases is not causing relatively as many hospitalizations locally as the spring surge because of the fall cases have been concentrated among younger individuals who are better able to fight off the disease. As people go home, as more people go indoors, that is our concern, he said. If we need to find an alternative site, we will do so. Hopefully, we can keep it all within the hospital walls. Bonneau said he's confident Portage is prepared, along with other area hospitals, for an increase in hospitalizations. We're still in okay shape, he said. Certainly, it's time for us to be prepared for a new wave of patients. We're in very good shape in terms of the plan to scale it up and down. There are multiple levels between today and opening any kind of care site. On the flip side, I don't want to give the impression that anyone should relax. Our next article is titled High Turnout, Lines Expected in Final Days of Voting in the 2020 Election by Diane Smith. Higher voter turnout is expected for Tuesday's general election, both in early voting and voting Tuesday at polling locations throughout the county. In addition to the presidential race, Portage County voters will elect a new sheriff and decide numerous races for various county posts, including 2 races for county commissioner, common pleas court, and county recorder, as well as races for appellate court and Supreme Court judges, state representative, state senator, and Congress. In addition, several issues are on the ballot, including schools and library levies. We spoke to Faith Lyon, director of the Portage County Board of Elections, to discuss voter turnout and what voters can expect in the final days leading up to the election day on Tuesday. What is the turnout expected to be? 78%. Portage County saw a 72% turnout in 2016 for the most recent presidential election. What if I still have my absentee ballot? What should I do with it? Can I still vote at the polls on Tuesday? Do not wait, Lyon said. Return your absentee ballot as soon as possible, either by mail or by placing it in our secure ballot drop box. If you mail your ballot, it must be postmarked by Monday, November the 2nd, which is today. Ballots may also be returned to our secured ballot drop box until 7:30 p.m. on Tuesday, November 3rd. No postage necessary. Those who do not return their absentee ballot and vote at the polls instead must cast a provisional ballot. Provisional ballots will not be counted until the official canvass on November 18th. How many absentee ballots are outstanding? Just over 4,500 ballots were outstanding as of Friday. As of Thursday, Portage County election officials had received and processed 32,325 total requests for absentee ballots. How many ballots have been cast to date? A total of 41,045 ballots have been cast as of Thursday. with a long line of voters waiting to cast ballots in person, Lyons said. Of those, 12,829 people voted in person, with another 28,216 ballots that were mailed or put in the drop box, including those sent overseas and to military voters. Voters are taking advantage of both the county drop box and the Postal Service. Mail does seem to be slightly more popular, Lyons said. What should I expect if I decide to go to the polls on Tuesday? We expect a high turnout at the polls on Tuesday, Lyons said. Expect to see lines at your polling locations due to social distancing and high voter turnout. Make sure you bring and wear your mask while voting. You may also bring your own pen for marking your ballot, as long as it is a black or blue ballpoint pen. Voters also should remember to leave their campaign gear at home. Hats, t-shirts, buttons, pins, face masks, and any other items supporting a candidate, political party, or issue group are prohibited inside the polling location. If you need to vote absentee because you're quarantined, is it too late to request a ballot? The deadline to request an absentee ballot was noon on Saturday. If individuals are concerned about the possibility of being quarantined, don't wait, she said. Vote early, in person, at the Board of Elections office. What are the final days and hours for voting? Early in-person voting is taking place at the Board of Elections office, 449 South Meridian Street, from 1 to 5 p.m. on Sunday and on Monday from 8 a.m. to 2 p.m. The first election results released on election night are the absentee ballot results, which included early in-person voting. Local polls will be open from 6:30 a.m. to 7:30 p.m. at local polling locations. There will be no ballots cast at the Board of Elections on Election Day. Streetsboro Schools and Unions at Odd Over Health and Safety by Kristen Cano. Streetsboro Schools, 2 unions recently met with district officials to negotiate their contracts, but have yet to come to an agreement on several issues, most notably policies and procedures related to the COVID-19 pandemic. Meanwhile, the district's Board of Education, the Streetsboro Education Association, and the Streetsboro School Support Personnel Association have filed unfair labor practice charges against one another with the State Employment Relation Board. At issue are the terms related to creating a safe and healthy work environment, and when those terms were introduced to negotiation. Negotiations started November 2019 for SEA and January 2020 for SSSPA before the pandemic. At the time, the unions were already asking to bargain over establishing a safe and healthy work environment, according to the unions, complaints against the district that were filed on Tuesday. Initially, health and safety issues centered around teachers not feeling safe in their own classrooms due to student behavior and how the district responded to those incidences. But, they say, the board refused to bargain over health and safety in general. This subject has always been presented as a critical issue for bargaining, even before the COVID-19 pandemic. Now, this subject has become more important than ever, the complaint states. The union says they officially notified the district of their intention to negotiate COVID-related items in May and repeated their demands in writing in July and August. In mid-September, the board told the union it had no intention to bargain over health and safety standards, including those related to COVID-19, according to their complaint. In its own complaint against the SEA filed earlier this month, the Board of Education asserted the union introduced COVID-19 related terms on September the 30th in a memorandum of understanding. The district has also filed an unfair labor practice charge against SSSPA for introducing new terms, but as of October 29th, SERB could not provide the documents. The inclusion of additional items for bargaining long after bargaining began and without the mutual consent of the board is a violation of the negotiated agreement, according to a district-issued press release. How were the SEA and SSSPA bargaining teams to have predicted a global pandemic back in November 19 and January 2020, respectively? How many people in this country could have predicted such a thing during those months, the union wrote. The proposed MOU includes terms for leaves and compensation for members forced into isolation and quarantine, a requirement the district adheres to its own reopening plan. The availability of mental health resources, the hiring of 2 permanent substitutes, and the implementation of a calamity day when a building is missing more than 20% of staff members, among other demands. The SEA has also made settling the multi-year agreement, which includes raises for staff and improvements to educate students, contingent on reaching an agreement on the new items. While the board has provided a response to the new items and is willing to discuss the items with the SEA, it is not willing to have the outcome of negotiations hijacked by the SEA's new demands, the district wrote. To address the MOU separately, the board has agreed to continue paying SEA members who are subject to specific quarantines so that they do not have to use their sick leave, will adhere to their own reopening plan and any directives from state and local health officials, and will continue the way it's reassigned students to ensure that social distancing is maintained. In response, union spokesperson Holly Paterniti said that any proposals offered by the board specifically forbid any way to enforce the agreements. Who would have ever entered into an important agreement that provides no recourse if the other side refuses to honor it, she said. The next negotiating sessions are on Monday for the SEA and Wednesday for the SSSPA. Both unions have overwhelmingly approved 10-day strike notices, which allows them to file a notice of intent to strike and picket with the school board and SERB at any time. Were they to issue the strike notice, the unions would have to take another vote to actually go on strike. Under Ohio law, school employees on strike cannot be paid and will lose their health insurance coverage. It's shocking to me that the union leadership would have its members go on strike and lose their health insurance during a global pandemic, Superintendent Michael Dalbaugh wrote in a press release. Union guidelines specifically prohibit officers from introducing strike votes, and the entire membership votes on whether to go on strike. This is workplace democracy in action. The leadership doesn't send anyone anywhere, and our members will make that important decision based on what is best for their students and for themselves and their families, Paterniti said. In addition to health and safety concerns, the unions are also hoping to address special education workload management, more ops. Our next article, Know Before You Go, Kent State urging students to get tested before holiday travel, by Krista Cano. Kent State University is urging students, faculty, and staff to take advantage of free COVID-19 testing before leaving campus for Thanksgiving break and to adhere to all safety protocols during their vacation. Thanksgiving break for students is November 23rd to November 29th, and beginning November 30th, all classes and final exams will be delivered remotely through the end of the fall semester. Earlier this year, the university changed the academic calendar so that students would not return to campus after traveling for Thanksgiving. Students will not return to campus until the spring semester. It is crucial that we do our part to not spread the virus to those more vulnerable, such as elderly relatives and others you may encounter over the holiday. This is particularly important for those who plan to travel throughout Ohio and to other states for Thanksgiving. Know your status so you don't unwittingly infect others. Pandemic Leadership Committee Chairperson Manfred Valdomen wrote in a university-wide email. To help get students tested, the Ohio Pandemic Testing Team, staffed by medics from the Ohio National Guard, will return to campus from 10 to 6 p.m. November 15th at the Student Center Ballroom. Testing is free and open to all. The event will also include a flu shot clinic. The testing is in addition to the free testing already available to university community members, regardless of symptoms, at the DeWeese Health Center and CVS Minute Clinic locations throughout the country, and the weekly random testing conducted by CVS Health. Those who are traveling out of state should also be aware that health officials may require quarantining upon arrival, depending on whether Ohio is considered a high-risk state by the Center for Disease Control and Prevention. Conversely, those returning to campus after the break from certain states will be expected to quarantine upon their arrival in Ohio. Currently, the states in that group include South Dakota, Idaho, Wisconsin, Iowa, Alabama, Nebraska, Kansas, Nevada, and Utah. Weekly updates on travel advisories for returning to Ohio can be found at the Ohio Department of Health. Anyone traveling out of state should notify the COVID response team at 330-672-2525 upon their return to campus, Van Dolman said. Even those traveling within Ohio should be aware of the county's risk level and any additional regulations. Taking precautions against this virus doesn't stop when we leave campus. Most spread of this virus is happening at social gatherings and through our interactions with others, so we must use extra caution throughout the holiday season. Upcoming travel for the holiday has the potential to create a significant increase in the spread of this deadly virus. Let's do all we can to protect our families and communities, Van Dolman said. Kent City Health Commissioner Joan Seidel is urging everyone to use facial coverings and adhere to social distancing over the holidays. These are really powerful tools and can make a big difference in how COVID spreads in our communities. Certainly, we want the comfort of our traditions this year, but our traditions may look a little different, but they can still be full of meaning and they can still lift our spirits, she said. Seidel recommends be thoughtful about what people you invite into your homes and to limit the number of visitors. Maybe look at spacing out smaller groups throughout the week. Extend the holiday celebration so that it's not one large gathering, she said. We need to think about smaller groups and smaller numbers. Because of the changes that COVID-19 has imposed on our lives, traditional gatherings may look a little bit different, but holding them safely can mean that they turn into wonderful memories instead of tragic events, Seidel said. Well, up next, Kent will reinstate downtown refreshment area. According to a press release by the city's unified command team, it was decided that the combination of colder weather and the upcoming departure of many of the Kent State University students starting November 21st should lessen the risk associated with improper masking and inadequate social distancing. Members of the UCT include City Manager Dave Ruler and Health Commissioner Joan Seidel. A designated outdoor refreshment area, or DORA, is an area within a city where alcoholic beverages can be sold by licensed liquor establishments for outdoor consumption. The Kent City Health Department urges people to follow protocols when patronizing the DORA or venturing into any public area. Wearing a mask is still required when inside a business and should be worn at all times unless seated and consuming food or beverages. Social distancing is still an important component of preventing the spread of COVID-19. Patrons are asked to please maintain at least 6 feet distance between themselves and others, non-household members, even when outdoors. Masks are not a replacement for social distancing. Do not go anywhere public if you are feeling sick or unwell. There is still active community spread of COVID-19 in the community. Patrons should be aware that the reopening of the DORA is to bring people downtown to support local businesses under strict safety guidelines, not to overcrowd the area. Please be aware of your surroundings and follow the above safety measures. Businesses with a SAFER pledge posted are certified by the health department as following the public health guidelines. If a business does not have a pledge posted, they should contact the health department if they would like to be certified. If improper behavior is observed more than occasionally, it is possible that the DORA may be suspended again, according to the committee. The DORA was suspended starting October 30th by Jeff Saunders. In Kent, as the small group, he was waiting to enter Dominic's Bar on Franklin Avenue late Saturday afternoon. Chase Rousley said he did not feel he and his friends were in significant danger from COVID-19. If you go out, follow protocol. Do what the bartender tells you, said Kent State University senior. Rousey added that the bar employees tend to do a good job policing patrons and making sure they are following the rules. This is a holiday. It's going to be safe, he said. A Kent police dispatcher said that as of about 8:40 p.m., there had not been any arrests or reported problems due to the Halloween celebrations downtown. The area traditionally brings large numbers celebrating Halloween, many in costume, in an event that is not officially sanctioned, so there are limits on what the city officials can do. But the group Rousey was with, which fluctuated in size from a handful of revelers to 10 or 12, constituted a crowd on the street at that time. City officials have said they expected that with the pandemic. The crowds would be smaller, especially with bars scheduled to close at 10 p.m., but even smaller groups had them worried. City Council recently passed an ordinance prohibiting gatherings of 10 or more non-household members, but it does not apply to bars and restaurants. Violations carry an initial $500 civil fine and can go up to $1,000 if sent to collections, and Kent State University students could face additional penalties imposed by the university. When COVID hit, we got to go to bars because we can't have parties, said KSU student Jake Elliott, who was also waiting outside Dominic's. But Elliott says he believes all the precautions taken are not really doing much good because people are going to break the rules. Everyone still does the same thing. We just have it more secret, he says, adding, if they wanted everyone to be safe, they shouldn't have let anyone go back to school. Shortly after that, Elliott and a couple of others were allowed into the bar. KSU junior Paul Lopicolo said he does not want anyone to get the idea that he and others waiting were being reckless. We've got to be safe and courteous to people, he said, adding, if we're playing it safe, we're wearing masks. We're not doing anything wrong. Halloween brings revelers to downtown Kent. Scooby-Doo spotted on West Main Street. Kent police said they're planning on having an increased presence downtown during the evening. Staff of the city's health and fire departments, as well as university officials, also said they plan on making some rounds around the city to make sure people are observing social distancing, mask wearing, and occupancy limits. Rousey says he takes precautions. I don't go out with random people I don't know, says Rousey. I don't go out to random places. Lopicolo said he is optimistic things will work out in the end. We're going to get through this, he said. Well, friends, that concludes the reading of the Record Courier for Friday, November 2nd. Thank you for inviting me into your home, and this is Pam. Please stay safe until we're here together again. Be abundantly blessed and do what you can do to make today a really great day.